Hi, welcome to Health Talk with Dr. Akram. I am Akram. This is a special YouTube edition. Today we're going to talk about HPV, otherwise human papilloma virus. Nearly every individual is infected by HPV at some point in their lives. HPV is the most common sexually transmitted infection globally. Worldwide in 2018, an estimated 569,000 new cases of cervical cancer occurred, with 311,000 deaths. Around 85% of these cervical cancers occurred in low and middle income countries. HPV infection is an infection caused by human papilloma virus, a DNA virus. About 90% of HPV infections cause no symptoms and resolve spontaneously within 2 years. However, in some cases, an HPV infection persists and results in either warts or percutaneous lesions. These lesions, depending on the site affected, increase the risk of cervical cancer, vulval cancer, vagina, penis, anus, mouth, or throat cancers. Nearly all cervical cancers is due to HPV. Two strains, HPV 16 and HPV 18, account for 70% of cases. Between 60 to 90% of other cancers listed above are also linked to HPV. You can have HPV for many years without it causing problems. You can have it even if you have not been sexually active or had a new partner for many years. HPV has no symptoms, so you may not know if you have it. You do not have to have sexual contact with a lot of people to get HPV. You can get HPV the first time you are sexually active. Let's discuss about warts a bit before we go ahead with HPV. Warts is a skin infection with HPV can cause non-cancerous skin growths called warts or verruca. Warts are caused by a rapid growth of cells on the outer layer of the skin. Common warts are usually found on the hands, feet, but can also occur on other areas such as the elbows or knees. Common warts have characteristic cauliflower-like surface and are typically slightly raised above the surrounding skin. Cutaneous HPV types can cause genital warts but are not associated with the development of cancer. Well, let's look at the prevalence of HPV. Globally, 12% of women are positive for HPV DNA, with rates varying by age and country. The highest rates of HPV are in younger women, with a rate of 24% in women under 25 years. The rates are highest in sub-Saharan Africa, 24%, and 21% in Eastern Europe. In Sri Lanka, the prevalence of HPV is 15.5%, regardless of their cytological abnormalities. Let's look at the transmission. Over 170 types of HPV have been described. More than 40 types may be spread through sexual contact and infect the anus and genitalis. Risk factors include early age of first sexual intercourse, multiple sexual partners, smoking, poor immune function. These types are typically spread by sustained direct skin-to-skin contact. Also, HPV infection can spread from a mother to baby during pregnancy. There is no evidence that HPV can spread via common items like toilet seat. But the types that cause warts may spread via surface such as floors. When an infected person walks without slippers and the virus gets transmitted from the foot to the floor can harbor the virus for a long time and get transmitted to another person. HPV is difficult to remove via standard hospital disinfection techniques and may be transmitted in a healthcare setting on reusable gynecological equipment such as vaginal ultrasound transducers. The period of communicability is still unknown. HPV may still be transmitted even after lesions are treated and no longer visible or present. Hospital transmission of HPV, especially to surgical staff, has been documented. Surgeons, including urologists and anyone in the room, is subject to HPV infection by inhalation of noxious viral particles during electrocautery or laser ablation of a condyloma or cold wart. There has been a case report of a laser surgeon who developed extensive laryngeal papillomatosis after providing laser ablation to a patient with anogenital condylomata. Sharing of possible contaminated objects, for example races, may transmit HPV too. Disinfectants. The virus is unusually hardy and is immune to most common disinfectants. It is the first virus ever shown to be resistant to inactivation by glutaraldehyde, which is among the most common strong disinfectants used in hospitals. However, diluted sodium hypochlorite bleach is effective. Testing for HPV. HPV testing is part of cervical screening. There is no blood test for HPV. During cervical screening, a small sample of cells is taken from the cervix and tested for HPV. Screening is offered to all women aged 25 to 64. It helps protect them against cervical cancer. Let's look at the treatment. Well, unfortunately, there is no treatment for HPV. Most HPV infections do not cause any problems and are cleared by your body within 2 years. But treatment is needed if HPV causes problems like genital warts or changes to cells in the cervix. Genital warts can be removed by freezing. HPV vaccines can prevent the most common types of infection. To be most effective, inoculation should occur before the onset of sexual activity and are therefore recommended between the ages of 9 to 13 years. And this is the only treatment so far we have, this HPV vaccine, apart from what we said, the cervical ablation, which you could do after if the infection develops. But the vaccine will prevent it most of the time. Cervical cancer screening, such as the Papa Nicolau test or pap smear or examination of the cervix after applying acetic acid, can detect both early cancer and abnormal cells that may develop into cancer. Screening allows for early treatment, which results in better outcomes. Screening has reduced both the number of cases and the number of deaths from cervical cancer. Well, in our next video, we're going to talk about HPV vaccination. So until then, look after yourselves. See you there in our next episode. Thank you.
Did you ever wanted to study abroad, but don't know where to start? Then look no further, because IES got you covered. With dozens of universities and courses ready for your choosing, you too can earn a world-class degree for an affordable price. In your time, indulge yourself in the rich and magnificent cultures of Bulgaria and Romania without any worries, because IES will help you every step of the way, from visa application to legalization of documents and more. For further information and inquiries, contact us now. International Admission Services, making dreams come true since 2012.